Mr. President, the Senate minority leader, Senator Reid, came to the floor a couple of days ago and talked about health care. He said, if people, this is a quote, he said, if people would just look at the newspaper, they would see that Obamacare has changed America, in Senator Reid's words, for the better. Well, Mr. President, millions of Americans do pick up the newspaper. I hope that many of them saw your editorial in today's Wall Street Journal about some of the travel and some of the things that you've seen about our nation's security. But I'd like to point out to Senator Reid that there have been headlines in the paper repeatedly, including one in the Reno Gazette-Journal this month, that said Nevada, his home state, ranked 48th in health care by a finance website. A finance website. They're talking about just how bad the health care law has been for the people of his home state of Nevada. It was about a new survey that looked at things that health care costs and access to care and how they impact people at home. So if Obamacare was so great, at least as great as Senator Reid says it is, then why is his home state ranked almost dead last? Look, Americans are seeing headlines like the one that appeared the day that the senator came to the floor. The front page of the Washington Times, had he picked up and looked at the paper on the way to the floor, he would have seen a headline on the front page saying, "Failures of Obamacare." Front page the day he came to the floor and said, check out the headlines. It says, Democrats see need for a fallback plan. They need a fallback plan because this health care law has been so devastating to people all across this country. If Obamacare is so great, why do the Democrats need a fallback plan? Look, people across the country are seeing headlines like this every day. The Washington Post headline, health care exchange signups fall short of forecasts. New York Times, Obamacare options. In many parts of the country, only one insurer remains. Another New York Times edit, cost of health laws plans set to rise more sharply. This in the paper The Hill, Dems to GOP, help us fix Obamacare. They didn't turn to Republicans for solutions and ideas when they forced it through on a party line vote. They didn't listen to us and our concerns about the impact of this law on the families of this country. Now they come to us and say, help us fix the mess they've made. USA Today, and I would point out to Senator Reid, Obamacare rate hikes rattle consumers, could threaten enrollment. New York Times, the incredible shrinking Obamacare. And since Senator Reid came to the floor and made this statement a couple of days ago, let me point out a few other headlines that have arrived since that time. Bloomberg, Friday, failing Obamacare nonprofit co-ops add to death spiral fears. Didn't have to turn to the newspaper, could have turned on the radio, National Public Radio, just Friday, about people who are buying insurance for their insurance because the Obamacare program is so bad for them personally. And then Sunday's New York Times, the business section, why Obamacare markets are in crisis. And I would suggest that the minority leader look at today's newspaper in Indiana. Indiana University Health Plans quit Obamacare exchange, citing heightened financial uncertainty. Those are the headlines people are seeing all across the country, so I'm not sure exactly what newspaper the minority leader is reading, but he's not reading the same papers that Americans all across the country are reading. All across the country, people are hearing about their rates going up. In Georgia, 33%, Illinois, 45%, Tennessee, 59%. People are feeling the pinch from this rising cost of the Obama health care law. It's hurting the people who buy insurance through Obamacare exchanges, and it's hurting the people who get their insurance through their jobs. A new report by the Kaiser Family Foundation says that for people who get their insurance at work, the deductibles have risen 4 times faster than the premiums did. So it's not just the premiums that are going up, the deductibles are going up. and all of those are new costs as a result of the health care law. The American people are feeling it in their wallets. Millions of Americans are rejecting Obamacare insurance because they know it's not of good value for them personally. According to one article, 8 million people face tax penalties this year for not buying Obamacare coverage. These are people who can't afford this expensive, second-rate insurance, or they don't think that it's right for them or their family. The Democrats who wrote this law, who are now asking for help in, quote, fixing it, they don't really care. They just want people to write their checks to the IRS, their penalties because of the mandates of the law, the taxes, the fines. These are for people who have no options. No options is exactly the situation that most Americans are facing. Major insurance companies have decided to leave most of the Obamacare markets. You just look at the insurers who are fleeing the Obamacare exchange. Humana is selling coverage in 19 states this year. It's going to be in just 11 states next year. Look at United Healthcare, 34 states this year, down to 3 next year. Aetna, going from selling Obamacare plans in 15 states this year to just 4 states next year. On November 1st, millions of Americans will go to sign up for Obamacare, and they will find that their insurance plan has disappeared. Companies are running for the exits. The program is collapsing. It is in a death spiral. And the co-ops, Mr. President, the co-ops, 23 co-ops under the health care law. So far, 17 of them have failed, including the one in Senator Reid's home state of Nevada, went out of business at the end of the last year. With all these companies shutting down and dropping out, people living in 1/3 of the country are going to be left with just one option for where to buy Obamacare coverage in November. One option is no choice. It's not a marketplace, it's a monopoly. Under Obamacare, we've seen medical costs skyrocketing, people losing their insurance, so it's no surprise that there is enormous anger and anxiety about the health care law, to the point that in a Gallup poll earlier this month, 29% of American families say they have actually been hurt, personally hurt by the health care law, and only 18% say they've been helped. Mr. President, Republicans said this is what was going to happen. Democrats ignored them. They ignored our concerns to try to improve health care for Americans. Democrats went into a back room behind closed doors in Harry Reid's office. They wrote a law, they passed, no Republican support, and this is the result. We have offered, Mr. President, direct solutions to the problems. We have offered relief for the American people. And my colleague from Arizona, Senator McCain, who is on the floor, has offered a bill to provide that relief for people who are hit with mandates, taxes, fines, penalties because of the law, the mandates of a law that is too expensive, too costly, hurting American families. And I'm proud to co-sponsor Senator McCain's legislation to provide that relief. So, Mr. President, when people say, will you work with Democrats, I will say this. If the Democrats want to work on a plan that provides nothing but more Obamacare and more federal control, count me out. But if they want to work on a plan like I have introduced with Senator Graham from South Carolina and Senator Ayotte to provide opportunity, freedom, choice, flexibility at the state level to empower individuals and states, then count me in. But, Mr. President, when you look at a program that is impacting America, 29% of people hurt by the president and his law, only 18% helped. I would say to the President of the United States, you shouldn't have had to hurt so many good people trying to help those who didn't have insurance. Mr. President, this is a law that needs to be repealed and replaced, and right now I'm proud to stand with Senator McCain in his efforts to provide relief to the families who feel betrayed by this president and this law. Thank you, Mr. President. I yield the floor.